My name's Dr. John Pawlovich. I'm a family physician. I'm the Rural Doctors UBC Chair in Rural Health. I help support multiple communities in north central British Columbia, where I'm part of a multidisciplinary healthcare team that provides support for many marginalized, remote Indigenous communities. Undoubtedly, the most important quality that we aspire to with patient care in the communities we serve is trust. The trust has been established over many years of visitations to communities, meeting people where they are in their respective communities, sharing time with them in their houses, on the land, in health centers. Back in 2014, we had a patient present in a very remote community that I helped support in great distress. They were having a cardiac problem at the time that was very challenging both for the patient and for the two local nurses in the health center. And this was a life-threatening situation. Very quickly, we understood that this patient required a level of care that historically they wouldn't be able to acquire in this community without a video-enabled call. Myself and a colleague were able to connect in with the nurses. We were using a satellite-based system, and we were able to do what we call as a cardioversion over telehealth, whereby somebody needs to have their heart basically jolted back into a normal rhythm and save them from a true cardiac arrest. That journey with that patient back in 2014 was a pivotal moment whereby we understood what is truly possible through the thoughtful integration of technology into a remote community and what we needed to build on moving forward. We now have the capacity to bring kind, thoughtful, compassionate help to the bedside in any rural community, in any remote Indigenous community in this province through the click of a button over a platform such as Zoom. The support for those healthcare providers, the care for those patients in those communities can be augmented and supported well through real-time virtual support. The ability to bring in a team and wrap itself around a patient through the integration of technology that can allow multiple healthcare providers to come to the bedside, be part of the team that supports the patient. So there's a very exciting project going on right now with UBC in the community of Stillatin First Nation, as well as the village of Fraser Lake, looking at drone technology and how it can influence the medical supply chain. Through drone technology, we're hoping to understand how we can positively influence getting medical supplies of a broad range to these communities. We need to embrace this technology now, not unlike we did with video technology over a decade ago, to start to understand what's possible. Technology keeps expanding. I think the important part for us all to remember and keep focused on are the relationships between the people. And that's the pivotal part. This is a human story, not a technological one. And we have to always put patients and providers at the center of all the work we do. I'd like to see that a young clinician who's fresh out of their training feels confident to go to a rural community, knowing that they're well supported, that help is just a click away, and that will lessen the barrier for healthcare professionals to go to remote communities. In the next 10 years, what I would like to see is an enhanced access to services for patients in remote communities. That is to say, more access to a family physician, more access to a specialist, that no community goes without high quality access to healthcare that they all deserve.